Bonjour tout le monde, merci d'être.
Hello, everyone. Thank you for being here with us this morning. I have the good fortune of being accompanied by Dr. Theresa Tam, who is the Chief Public Health Officer in Canada, and Dr. Howard New, who is, and we are in contact with my colleague Anita Anand, as well as my dear colleague Navdeep Bains, and everyone will be speaking today. We will begin with you, Dr. Tam.
Bonjour tout le monde.
Good morning, everyone.
137,555 cases of COVID-19 in Canada, including 11,521 deaths. Nationally, there are close to 57,000 active cases across the country. And over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive. Yesterday, 5,713 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to over 5,050 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,000 individuals with COVID-19 being treated in hospitals, including over 415 in critical care, and an average of over 70 deaths were reported each day. Following last week's epidemiology and modeling update, it's clear that we need to strengthen our response, specifically to bring down the rapid rate of growth. We need to combine a range of public health measures with tightened prevention practices by individual Canadians. In many ways, we have more to bring to this round of the effort in terms of experience, tools, and knowledge. But things are different this time. There are more regions of the country with high infection rates, and it is clear that COVID-19 knows no bounds. Communities, jurisdictions, and whole regions that were little, if at all, impacted in the past are now seeing community spread. Some areas are experiencing very high rates of infection for the first time. Nunavut has implemented territory-wide restrictions. Some of the Atlantic provinces have seen an increase in cases, and the Prairie provinces now have some of the highest infection rates in the country and are feeling a heavy strain on the healthcare system. There has also been a change in the age trend. In the early days of this resurgence, we saw high rates of infection among young adults. Now we are seeing an increase in rates in older adults, aged 80 years and older, who are at much higher risk of serious complications and death. Although it is still too early to know the impact of strengthened public health measures implemented in areas across Canada, we do know from the experience of many other countries that to be successful, a package of measures is required. It's not one size fits all. More importantly, we know that public participation is vital to success. This is why, as public health authorities implement measures to interrupt spread, Canadians are being called upon. It is safest for all of us to limit errands and outings to the essentials, limit in-person activities to our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing, frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's, crowded places, closed spaces, and close contact situations whenever you can. As we head into the holiday season, I know that things will be different and difficult choices will be required. Let's focus on the things we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. There have been 337,555 cases of COVID-19 in Canada, including 11,521 deaths. Nationally, there are close to 57,000 active cases across the country. Over the past week, labs across Canada have tested an average of over 75,000 yesterday. 5,713 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to over 5,050 cases for the past week. being treated in Canadian hospitals, including over 415 in critical care, and an average of over 70 deaths were reported each day. Following last week's epidemiology and modeling update, it's clear we need to strengthen our response. Specifically, to bring down the rapid rate of growth, we need to combine a range of public health measures with tightened prevention practices by individual Canadians. In many ways, we have more to bring to this round of effort in terms of experience, tools, and knowledge. But things are different this time. There are more regions of the country with high infection rates, and it is clear that COVID-19 knows no bounds. Communities, jurisdictions, and whole regions that were little, if at all, impacted in the past are now seeing community spread. Territory-wide restrictions. Some of the Atlantic provinces have seen an increase in cases, and the Prairie provinces now have some of the highest infection rates in the country and are feeling a heavy strain on their healthcare systems. There has also been a change in the age trend. In the early days of this resurgence, we saw high rates of infection among young adults. Now, we are seeing an increase in rates in older adults, aged 80 years and older, who are at much higher risk of serious complications and death. Although it is still too early to know the impact of strengthened public health measures implemented in areas across Canada, we do know from the experience of many other countries that to be successful, a package of measures is required, and it is not one size fits all. Most importantly, we know that public participation is vital to success. That's why, as public health authorities implement measures to interrupt spread, Canadians are being called upon. It is safest for all of us to limit errands and outings to just the essentials, limit in-person activities to just our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing, and frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's, crowded places, closed spaces, and close contact situations whenever you can. As we head into the holiday season, I know that things will be different and difficult choices will be required. Let's focus on the things that we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Merci beaucoup, Dr. Tam.
Thank you very much, Dr. Tam and Dr. New. I now invite my colleague, Ms. Anand, to speak.
Madame Anand, c'est à vous. Mr. Anand?
Minister Anand, you have the floor.
Good afternoon. I would like to begin by thanking all of you for limiting your in-person contacts and following public health advice. We know how important it is to follow this advice to slow the spread of COVID as we await the arrival of safe and effective vaccines. I will provide a brief update on the logistics that we are implementing for Canada's COVID-19 vaccine rollout strategy. For many months, alongside our efforts to purchase vaccines, we have been preparing for the administration and distribution of vaccines. We know that vaccine distribution will be complex, especially in light of the need to transport and store vaccines at specific temperatures. We continue to work with the provinces and territories to ensure that we are prepared to securely and efficiently deploy vaccines to Canadians across this country. The process of rolling out a vaccine from a procurement perspective has 3 phases: regulatory approval, distribution, and administration. On regulatory approval, 3 vaccine candidates have begun rolling approvals with Health Canada: Moderna, AstraZeneca, and Pfizer. This process will be rigorous, efficient, and based on science, not politics. The deuxième phase.
The second phase, distribution, when we will continue to work with provinces and territories to, in a safe and effective manner. Last, with Fisher Scientific and a little less of $900,000 to ESBE for an order of 26,000 freezers that can freeze to down to minus 80 degrees. These freezers can work at minus 20 Celsius.
Is in addition to existing federal capacity in this area. Overall, we have vaccines. We are also seeking to meet additional needs based on the Public Health Agency of Canada's requirements for more capacity. These efforts include, last week, issuing a competitive request for proposals for supplies of dry ice for use in certain cold chain transportation and storage. We expect to award contracts as a result of this competition next week. Continue avec distribution à la suite d'un processus.
To continue with distribution, following an invitation to qualify process, my department has also issued a request for a proposal for vaccine delivery across Canada. We anticipate being able to award
already put in place a number of contracts that cover everything from needles to the sharps containers in which syringes are disposed after use, from vials to the gauze and bandages used after injections. We have a contract with Becton Dickinson for 90 million syringes. We have contracts for 70 million gauze, bandages, and alcohol swabs. We also have put in place contracts to ensure that Canada has leading edge equipment used to fill and finish vaccines, machines that are made right here at fill and finish machines from VanRx in Burnaby, British Columbia. In fact, to date, we have already received enough deliveries of syringes and needles to administer 24 million doses of vaccines, and we have tens of millions more en route. In other words, we will not cease in our efforts to ensure that when a vaccine is ready, Canada will be ready too. Nous poursuivons nos efforts pour...
We are continuing our efforts to ensure that when a vaccine is ready, Canada will also be ready.
While Canada waits for a viable vaccine, our government continues to protect Canadians by procuring quantities of masks, gowns, and other PPE, and by making sure our healthcare system has access to treatments that support Canada's response. You know already that we have procured over 2 billion items of PPE for this country. And in terms of vaccines and therapeutics, we are also working on securing promising and effective treatments for COVID. In that vein, I am pleased to announce that we have signed an agreement with Eli Lilly for an initial order of up to 26,000 doses of its antibody treatment over the next 3 months. J'ai le plaisir d'annoncer que nous avons...
I am pleased to announce that we have signed an agreement with Eli Lilly for an initial order of up to 26,000 doses of their antibody treatment over the next 3 months.
AbCellera Biologics, a Vancouver-based biotechnology company right here at home in Canada that researches and discovers next-generation antibody drugs to fight infection and disease. The partnership combines AbCellera's advanced antibody therapy discovery platform with Eli Lilly's manufacturing and distribution capabilities. Health Canada granted interim authorization for Eli Lilly's treatment last week. It is the first antibody treatment to be approved for use in Canada under Health Canada's interim order to expedite the review and authorization of COVID-19 drugs. This treatment has the potential to help patients with mild or moderate COVID-19 who are at risk of progressing to severe illness by improving symptoms more quickly and keeping them out of hospital. In conclusion, from procuring vaccines to PPE to testing to therapeutics, Canada will do whatever it takes for as long as it takes to get Canadians through this crisis. Qu'il s'agisse d'achat de vaccins.
From procuring vaccines to PPE to testing to therapeutics, we will do whatever it takes for as long as it takes to get Canadians through this crisis.
Merci beaucoup.
Merci, Anita. Navdeep?
Thank you, Anita. Navdeep.
Good afternoon, ladies and gentlemen, and mes collègues, les ministres Anand et
My colleagues, Ministers Anand and Duclos, are with me today to mark this important milestone in the fight against COVID-19.
announced earlier today, as well as my colleague, Minister Anand, the government has signed an initial order with Eli Lilly for up to 26,000 doses of their therapeutic. And this is especially notable because the technology behind the important treatment is distinctly Canadian. The key antibody for this therapy was developed by Canada's very own AbCellera Biologics. And I got to know AbCellera early on in the pandemic as one of our first made-in-Canada solutions to respond in the fight against COVID-19. Des meilleures entreprises canadiennes en offrent.
The best Canadian companies have offered their expertise and their service to help us respond to the crisis, and AbCellera is among them.
Technology uses innovative AI technology to search and analyze blood samples of recovered patients to rapidly find antibodies that can be used to fight and prevent viral infections. Using this innovative made-in-Canada technology, the treatment was developed from an antibody that was identified from the blood of a recovered COVID-19 patient. And in partnering with Eli Lilly, AbCellera's discovery will be brought to market, commercializing a great Canadian innovation. So this truly is Canadian innovation on full display and on a global scale. And this will help save lives. Of course, in the long run, we want to see these great Canadian discoveries commercialized and manufactured right here in Canada. That's why in May, I announced a federal investment of $175 million to help AbCellera build an antibody manufacturing facility in Vancouver. This new facility, funded through the Strategic Innovation Fund, will be the first of its scale in Canada. And it will be capable of going from a patient sample all the way to manufacturing antibodies for clinical testing. So our government is a proud partner of innovative Canadian companies like AbCellera, and we will continue to strengthen our nation's capacity to respond to future pandemics for the protection of all Canadians. Thank you very much. Merci beaucoup.
Merci, chers collègues.
Thank you, dear colleagues. Now we would be pleased to take your questions. Thank you, Minister.
With questions in the room, we'll take 4 questions in the room and we'll turn to the phone. Madeleine?
Oui, bonjour, Monsieur le Ministre.
Hello, Minister Duclos and perhaps Dr. New. I was wondering if the vaccine distribution would take place according to provincial population. Thank you for the question. As the Prime Minister was saying this morning, that, of course, is part of very important discussions that we are currently having with our provincial and territorial partners. We are on top of this file. As we know, it's a high priority for Canadians, and very soon more decisions will be able to be told to you. I can also confirm that we will continue our discussions with our provincial and territorial counterparts as to the operational and technical requirements. Of course, we will receive recommendations from our advisory committee on immunization to decide which populations to prioritize initially. And that continues in these discussions with provinces and territories. Question. So if I understand you correctly, the decision hasn't been made yet. So what must be taken into account? Is there a population that's at higher risk in one province? If there's a higher at-risk population in one province, would they receive a higher number of doses? Could you be a bit more specific, please? Answer. Thank you. This is Dr. New. Yes. Of course, that is a factor, the population of a province, but as you said, there are other factors that we analyze, such as the proportion of the population in each province and territory who are, as we know, part of the vulnerable population. And so there are many factors that we're taking into consideration and that we are analyzing and that we are discussing with our counterparts.
David?
Hi, everyone. David Thurton, CBC News. I know we're talking a lot about vaccines today, and there's an epidemiologist are questioning Canada's lack of use of rapid COVID-19 tests. They say the approval is taking too long, and they point to several European countries that are using these tests to control the pandemic. So, Dr. Tam, why is Canada lagging so far behind when it comes to approving and using these rapid tests?
So rapid tests or point-of-care tests have been actually utilized quite effectively in some of the more remote areas. So you're seeing it's used, for example, in Nunavut right now in the communities. Many of them are approved by Health Canada, and many of them have been purchased, and Minister Nan can sort of talk about that. And they have been provided to provinces and territories, including PCR and antigen tests. So I think certainly, I'm trying to remember the number now, it's probably close to 5 million rapid tests have been distributed to provinces and territories. We've provided guidance as well. So I think they're in the midst of trying to figure out their best use, but some of them are being deployed, for example, to the testing centers, and others might be used for more high-risk settings. So the specific implementation, though, is with the provinces and territories.
So in total, the Government of Canada has procured more than 38 million rapid tests for the provinces and territories. We have distributed 4.6 million rapid tests to the rapid tests. So 4.6 million rapid tests have been distributed to the provinces and territories, with more on the way. That includes 2 million for Ontario, 1.2 million for Quebec, 300,000 for BC and Alberta, and 200,000 for Manitoba. And this is exactly the same process we followed with PPE. Our job, and in particular PHAC's job, is to get the stuff out to the provinces and territories. And once they're in those jurisdictions, then the responsibility rests with the provinces to make sure they're used in those jurisdictions.
Yeah. It's Dr. Yu, just to build on what Minister Nance said, that certainly when we're talking about rapid tests, I think we need to be clear that there's two types of rapid tests. There's the so-called molecular test, which is basically similar to the gold standard, the PCR molecular test that's in laboratories, and the so-called antigen test, which we also recognize from a sort of a sensitivity point of view, the characteristics are not quite as good as the PCR test. So as Dr. Tam and others have stated, we've actually received and shipped out, I think, by my figures, over 200,000 of the so-called Abbott ID Now. That's the molecular rapid test. And certainly that's been used, I think, in good effect up north in remote and isolated communities. Certainly they're being used in places like Nunavut right now. The antigen test, which we recognize needs to be used as part of an overall testing strategy. We've actually published guidance. It's out there. The provinces, territories know that the specific circumstances, we've said that before, maybe for frequent testing in certain high-risk workplace settings like meatpacking plants, certainly to be used in long-term care facilities, maybe at the beginning of an outbreak investigation, and so on and so forth. So the tests have been distributed. Certainly, as Minister Anand said, over 4.6 million tests overall have been distributed to the provinces and territories. The guidance is out there. I think you'd have to ask the provincial and territorial authorities in terms of how they're actually being deployed on the ground. Thank you.
But yes, thank you. But I'm just wondering, is that it? And that's significant. And don't get me wrong there. There are other jurisdictions, such as the UK, that have approved, from what I understand, at-home kits. So there's more that other places are doing. Are we going to see something like that? Is this the it when it comes to rapid testing, or is there more approvals? Is there more work that you guys are going to be doing at the federal level? Because it's still a big issue.
Well, the regulator is doing everything they can, and there are other rapid tests that are in the pipeline which can be reviewed. And if a manufacturer of a truly home test applies, then they will be, and they're pursuing, the acquisition as well. So no, this has not stopped. This is not the end. The 38 million is not the end. We will continue, I think, to work as hard as we can, also on other options.
This is Dr. New. I don't just build on what Dr. Tam has said, is that certainly, the whole approach of what we call, testing, tracing, isolation is an important part of the public health approach, but it's not the sort of be all and end all, in and of itself. We're not going to test our way out of this situation. It also depends on the individual behaviors of Canadians. We've stressed that so many times. The basic public health measures, both at an individual level and certainly what governments and public health authorities may need to impose as well. So certainly, the availability of testing is one thing, and it needs to be used to its best advantage. But it's not going to be a sort of the silver bullet on its own. Certainly, we're also hearing situation stories of people becoming tired, not wanting to go getting tested and so on and so forth. So those are all other aspects we need to look at as well. So, I can say the actual availability of whatever technology, be it testing or anything else, is certainly an important part of it, but it's not sort of the whole solution.
Thank you, Dr. Tam. We'll take one last question in the room before turning to the phone. I know Dr. Tam is expected to be somewhere. I think Dr. New will remain here to answer the following questions. Rachel?
Thanks. I thought you said we had 4 in the room initially, but this is Rachel Haynes here from CTV National News. I just have a question for the doctors of, can you give us an update on how close Health Canada is to approving these vaccines, the contracts that we have with Pfizer, Moderna, and AstraZeneca? How close are we to seeing those approvals?
That would be up to the Health Canada regulatory authorities. What they have done is to, special authorization from the perspective of the rolling submissions that you've heard about. So data as they become available is expected to be submitted to Health Canada. So I can't tell you the precise timing of what they will be doing. But of course, the paramount most important thing is that they are really rigorously looking at, they have to look at the data from the perspective of safety and efficacy and quality. The quality bit people may not understand as much is that depending on where the vaccine is produced, there's manufacturing quality assurances, there's even lot-to-lot reviews that has to happen as well to authorities so that they can get that data as fast as possible. But I would not want to sort of intervene on the rigorous process that the regulatory authorities are doing. But they will be working as fast as possible. I know that will be 24/7. They've really boosted their capacity to do that.
The Prime Minister said, though, that he expects the delivery of vaccines in about early 2021. So does that kind of line up with the Health Canada timeline that you know of, or are we going to find ourselves in a situation where Canada receives vaccines, but then we can't actually deliver them to Canadians because Health Canada hasn't approved them yet?
Well, I think, as I said, all hands on deck in terms of the regulatory review, but you want that to be done properly. Whether you can, lots of things are being done in anticipation of. So I'm sure we'll still be getting ready so that we can be, of course, if necessary, ahead of the game. But so all the pre-purchasing and logistics are done. But we want to make sure that every Canadian knows that whatever we are going to be authorizing would have undergone that rigorous process. But I think that as much as possible, people are trying to line up the critical path.
I might just add from a procurement process, our contracts with the vaccine suppliers contemplate Health Canada approval in order for the deliveries of the vaccines to occur. And in particular, vaccine suppliers are very conscientious about not having vaccines go to waste and making sure that they are used as soon as possible. And so we are very much in touch with suppliers so that when Health Canada approval has been granted, we are able to move very, very quickly on the deliveries into Canada. Thank you.
Thank you, Minister. We're now going to switch to the phone. Operator, over to you.
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from...
First question is for Minister Duclos. I'm not sure if he's still there because I can't see him on my screen. Mr. Duclos, will you be appointing someone at the federal level who will be responsible for leading the vaccination operation? As Rick Hillier did previously. Will you be recruiting someone, or will it be a minister or a committee that will be leading the operation? Answer. This is what we call Team Canada. In Team Canada, of course, we've got the federal government, which, as we heard, is responsible for access, approval, transportation, storage, and support for administering the vaccine, which will play a particularly important role given the current circumstances, which are absolutely unusual in the usual practice, within the usual context of vaccination. So, but it is a team. We have to work with provinces and territories, and in doing so, we will indeed call upon all of the federal government's resources, including the considerable capacity of the Canadian Armed Forces and the significant procurement capacity that Minister Annan mentioned earlier, the private sector capacity as well that we are going to mobilize to as fully as possible in the coming weeks and months. So this is altogether Team Canada, and we'll be working in a Canadian model of full partnership amongst the various levels of government and various stakeholders, including, once again, the Canadian Armed Forces and the private sector. Follow-up question? Yes. Mr. Duclos, so is your answer no, there will not be a single person named to lead the effort?
Anand, I would like to hear about the freezers that the federal government has bought or is about to buy. How many do we have right now? How many have been minus 25 Celsius? And where will they be located? Is there going to be like a freezer headquarter in Ottawa?
Merci beaucoup pour la question.
Thank you much for the question, but I will answer in English.
Such a great question, because what we are putting in place is an end-to-end logistics system to ensure that from the moment the vaccines arrive into Canada until they are actually administered to individual people, we've got the logistics system in place. And indeed, the freezers that you referred to are part of that end-to-end logistics system. In particular, what we have done so far is to secure 126 Panasonic and thermal scientific freezers for ultra-frozen and frozen vaccine storage. 100 minus 20 degree freezers and 26 minus 80 degree freezers have been secured. More than 30 freezers have already been received by the Public Health Agency of Canada, and deliveries are continuing. Each freezer holds hundreds of thousands of doses. With existing federal capacity, we can store approximately 33.5 million ultra-frozen and frozen doses at one time. We are also securing a supply of dry ice needed for this end-to-end logistics transportation system. The dry ice is going to aid in safe transportation of vaccines across the country. And so we're working very closely with the Public Health Agency of Canada to ensure that when vaccines arrive in Canada, they are safely stored and transported. Thank you.
Thank you, Minister. Dr. Tam has to go, but Dr. New remains to answer your question. Operator, next question on the phone, please.
Thank you. The next question is from La prochaine question est de Tonda McCharles from Toronto Star. Please go ahead. À vous la parole.
Good morning. Minister Anand, if I understand then what you just explained, thanks for the clarification. If I understand it then, no matter that the delivery contracts would provide Canada with up to 6 million doses delivery by the end of March, if Health Canada hasn't approved, that vaccine doesn't arrive on
some of these vaccines. That is logically the case, right? And so, yes, that's the case. We've got to make sure that the timing of the deliveries is very closely tied to the timing of approval by Health Canada. And that requires constant communication with our suppliers, but the goal is to ensure it has been granted.
And this is, to me, as I understand it, the Deputy Defense Minister last week told the committee that the government hadn't asked, that the military doesn't have a role as of yet, but yet I understand that they may or are involved in the setting up of a national operations center to receive the vaccine. So I wonder if you can clarify what, if anything specifically, has the military been tasked with in this whole end-to-end chain you're talking about?
Well, thank you. I'll say a few words and then I'll let Jean-Yves step in if he wishes. I will just say that the end-to-end logistics system is a whole of government approach. All of our resources are on the table to ensure that when vaccines reach Canadians, they are deployed efficiently and as early as possible. And so this includes, from a procurement perspective, engaging a logistics provider to physically distribute vaccines to provinces. In addition, all options relating to other areas of government remain on the table. You will recall during the first phase of this crisis that we were very, very committed to utilizing all resources of government, and we continue to be committed to ensure that when vaccines arrive in Canada, they're safely and effectively deployed.
Yeah.
Jean-Yves?
So, it's Dr. New. Maybe I can add to that. Certainly, as Minister Anand has stated, it is a whole of government approach. Obviously, the federal government we're very seized with this, a very important initiative or project, as you might call it, and working closely with the provinces and territories. But I can speak more specifically to the Public Health Agency of Canada. We've stood up a very special team. I would call it maybe for lack of a better term at this point, a vaccine task force. And we've been working and been actively engaged with the Canadian Armed Forces. Certainly, we recognize they bring a unique skill set to the table, and certainly working along with our public health experts, with sort of the public health and medical aspects. For example, we recognize that in the area of logistics, certainly the Canadian Armed Forces bring a very unique expertise, and certainly that will be a major part of what I think will be part of the rollout of the vaccine. So I'll leave it at that for now. But certainly those discussions and those activities are ongoing as we speak.
Thank you, Doctor. Operator will now take one last question on the phone before turning back to the room.
Thank you. The next question is from La prochaine question est de Catherine Lévesque de la Presse canadienne.
The next question is from Canadian Press. Hello. My question is for Dr. New. We can see that Health Canada has published directives for the holidays. Directives that contradict or that are stricter than those published by Quebec last week. I wondered whether Health Canada is contradicting the Quebec government, or what are you telling people that this is creating confusion in the end? This is Dr. New. Thank you for the question. We do have guidelines on our website currently. Are there to give Canadians advice as to what should be done during the holidays. The principle is that the basic principle is that it's important to limit contacts. Big family gatherings are a no this year. That it's not like other holidays in previous years. It's better to have very small gatherings, really, if possible, only with the people from your own household. Even if you invite one or two other people, then you have to maintain physical distancing and wear masks and all of that. It's interesting because I also had a discussion with our Quebec counterpart, Dr. Aguda, and we are on the same page when it comes to principles and evidence-based decisions and science-based decisions. But our approach, as well as Quebec's, if I've understood correctly, is that we need to have social cohesion too. This is something that Premier Legault said. It's almost like a moral contract or a social contract with Quebec's population. Of course, we have to closely follow the situation over the coming 2 weeks. Right now, the principle is if everyone agrees across the population, and it is an individual decision, but if everyone agrees to self-isolate for a week before the holidays, perhaps, to really limit the number of contacts, that may be a small reward, allowing us to then have small gatherings of up to 10 people, no more than 10 people, up to the December 27th. And then people would have to agree to self-isolate again for the week following. And for the period leading up to schools reopening and all of that. That may be one way to strike a balance between total lockdown, because that's so hard on everyone, and also giving people a glimmer of hope so that everyone can have a target or a goal that we're all aiming for together. As Dr. Good and I discussed, if the situation is even worse than today, by December 27th, then the Quebec government may decide to adjust their own measures. Thank you. Follow-up question? Yes. Question. Then did the Quebec government say that they were going to add measures? Right now, I'm thinking of Quebecers who are making their holiday plans and who are confused by the contradictory guidelines that you published last night. Are you telling Quebecers to follow Quebec's guidelines or Health Canada's guidelines, or to just trust your own level? When we develop guidelines, they are aimed at the entire population, of course, but in my opinion, it's also a question of risk tolerance and risk management on an individual level. I've already made my plans with my family, but I'm not going to tell everyone else what they must do. Personally, I said, okay, perhaps I'll celebrate with my son who lives in Montreal, but that could change. But I said, look, we're not going to have a big family gathering with the whole extended family. My in-laws are from Quebec, so I'm not going to see everyone on that side. I'll just see my own children. So I said to my son, if you want to visit us here in Ottawa, are you prepared to self-isolate for 14 days before you come home? Stay in your apartment and only go out for essential errands like groceries? And he said, yes, I will do that because I really want to see you all, and I want to see my sister and brother. So, and I said, fine. And when he comes to our house, of course, everyone will be wearing a mask, even inside, even inside the house. We will be washing our hands, maintain social distancing, and do everything we can in terms of prevention, because from what I understand, that is the best way to strike a good balance between public health advice on an individual basis. So that's my plan. I can't speak for everyone. Of course, others may have a different view, but I believe the Quebec government is trying to do the same thing. Of course, we can give the whole population guidelines and directives, but let's say we have a limit of 8 people, 10 people, 12 people. What we truly must understand are the underlying principles of these guidelines. And then we can implement measures that are logical and then apply them to our personal situations.
Final question on the phone. Mia?
Mia Rabson from the Canadian Press. Dr. New, why is it that 8 months into this pandemic, we still seem to have such little amounts of information about where people are actually contracting COVID-19? There's such a significant portion of cases that we can't say this is where it came from. Why do we not have that data?
Well, if you're talking about the issue of data, it's something obviously that's top of mind. We're constantly working with our colleagues in the provinces and territories. It's for certain that yes, we could always be doing better. I think we've discussed the issue that there's certain types of data that maybe we haven't been systematically collecting, which I think highlight the fact that there are inequities in our society. For example, racialized Canadians, also individuals who are in certain socioeconomic classes that are deemed to be essential workers, that don't have the benefits, sick days and so on and so on and so forth. So, for example, gathering more ethnic data and more detailed data about sort of housing situations, that I think is the ideal, and we're working towards that, but that's not the reality right now. So that's something we're working towards. In terms of getting data right now, in terms of, let's say, that what you're, I think, alluding to in terms of the types of settings in which Canadians are contracting COVID-19, I think we need to recognize that in certain settings, it's easier to get the data, so it might actually skew the understanding, and people might think, oh, it's happening in schools, oh, it's happening in a long-term care facility. But if you step back and think about, well, of course, if you look at a school setting or let's say a long-term care facility, you have a set population. They're constantly under quote supervision, or the same people are always there every day. And therefore, if a facility and obviously hopefully do the right contact tracing and follow-up measures. When you're looking at other types of settings, that say, for example, bars and restaurants, we find a case afterwards, and they've been in sort of other settings where, it's not a fixed population, people move about and so on with mobility. It's more difficult to actually then pinpoint, say, oh yes, it's for sure that this person picked up their infection because they actually had dinner at this restaurant at this time. That's practically impossible. Data that we've received at the Public Health Agency are what we call sort of unlinked, or that there's no known source. And so we're getting reports that yes, sometimes it's private gatherings, it's sort of parties at home. Some people, yes, they've acknowledged they've been to a bar or restaurant. And that's the part I think that's challenging. And I think at the end of the day, we just recognize that really it is mobility, and the fact that people are still in a larger degree in contact with others compared to, let's say, the spring. I've mentioned before that when we had confirmed cases reported to public health back in the spring, and contact tracers went to those people and said, okay, so who have you been in contact with for the past 2 weeks? They might mention, oh, 4 or 5 people. I think, obviously, I think my neighbor next door, and my adult child who came to visit me. What's happened since then, let's say into September and moving forward, when they've had confirmed cases, the number of contacts identified are 20, 30, 40, 50. So I think people need to step back and think, wow, if I were to keep a personal diary from here on in terms of who I come in contact, would I be embarrassed, tomorrow or the next day if suddenly someone, told me I had COVID-19 and I had to be able to recollect or give the list of everyone I've been in contact with for the past 14 days. So that's something I think everyone needs to reflect on and not
focus on the settings and so on. I think it really comes down to everyone taking, I think, personal accountability for what they're doing.
The first thing we look to close down seems to be restaurants and stores and retail. Do we have any evidence that it's spreading there, or is there some other reason other than that to close those settings as sort of the first line of defense to slow the spread if we don't know that it's spreading there?
Well, I would say that certainly with the evidence, and we've talked about the 3 C's, crowded places, close contact, and, and so on and so forth. I'm not going to repeat all that. It just stands to reason that a setting such as an indoor space like a restaurant or bar, but then also the same thing in terms of a private residence. Those are places where transmission can occur. And certainly we recognize with our winter, people will be going more indoors, and certainly the situation is not ideal. So all of the basic public health measures, the hand washing, the use of face coverings, physical distancing, that's very important. The fact that we don't maybe have more fulsome data in terms of bars and restaurants, there have been documented, outbreaks, and I think there is sufficient data. That's how we actually have the scientific evidence to recognize that those types of settings, the closed indoor spaces with poor ventilation, are the settings in which the virus can be transmitted. So what I think I would say is that it's not that we're singling out any given sector. To the extent that Canadians take it upon themselves and recognize that their daily activities, in terms of what they do in their own private residences, who they get in contact with, family members, neighbors, and so on, has a ripple effect. Because we've been telling everyone for the most part, hey, stay at home, limit the number of contacts, and so on. But that becomes an issue of personal behavior. When that seems to not be working because case counts go up and then hospitalizations and so on, then the only sort of tool left, let's say, for governments and public health authorities is to put the hammer down and do what they can control, which is obviously the closing of certain settings in the private sector, be it restaurants, bars, and so on. But that's, I think, a last resort because if you look at the experience of other countries, if you go into, quote, a total lockdown and really limit people's movement and ability to be in contact with each other, with curfews and so on, yes, the case counts will go down. But we know there's a tremendous cost to that, both socially and economically, and that's what we're trying to avoid, trying to find that balance, a more targeted approach. But I would say in a perfect world, if everyone did what they really could or should be doing, really limit the number of contacts and only go out for, let's say, essential activities like grocery shopping, once a week and so on, then I would say that the incidence rate of cases should be going down, and then we wouldn't need to be in a place where governments have to make those tough decisions with lockdown measures or closing bars, restaurants, as you mentioned.
Merci, Dr. New. Thank you. On va prendre une dernière question au téléphone.
Thank you, Dr. New. We will take one last question on the phone.
La prochaine question est de Ryan Tumulty from National Post. Please go ahead. À vous la parole.
Yeah, I believe this question is for Minister Baines, but anyone should feel free to answer. The Prime Minister this morning said that we may be a little delayed on vaccines because we do not have domestic production capacity here in Canada. I'm wondering what steps the government has taken to address that problem and why they're not, I guess, leading to results now.
Well, thank you very much for your question. We recognize at the onset of this pandemic that it was important to build up domestic capacity for personal protective equipment and for the ability to support Canadian solutions for therapeutics and vaccines, and also to build up our biomanufacturing capacity. And since March, we made significant investments to that endeavor. We've invested in the National Research Council facility in Montreal as an example to build up that domestic capacity to manufacture vaccines here. The AbCellera announcement today, for example, speaks to the investments we're making in the Vancouver facility for therapeutics. We also made investments in Vito Intervac in Saskatoon, and we'll continue to provide updates on these investments, but it's going to take some time to build up domestic capacity, but it is a priority and part of our Made in Canada solutions that we highlighted in March. And we've seen improvements if you look at procurement, for example. We virtually had 0% procurements made with Canadian suppliers and local solutions. We're up to approximately 50 cents on the dollar, approximately 50% of the investments that we're making in procurement are made in Canada solutions. So we have that same mindset when it comes to building up our domestic biomanufacturing capabilities, and we'll continue to make those investments on a going forward basis.
Anita, would you want to say something?
Sure, you read my mind, Jean-Yves. I wanted to mention also that Nav's comments very well taken, and the fact that we have been able to put in place bilateral agreements with 7 of the world's leading vaccine candidates and access through 6 candidates through the COVAX facility, providing Canada with up to 414 million doses, speaks to Canada's ability to do 2 things at the same time: build up the domestic capacity that Nav is referring to, but also to put in place contracts of a complex nature to ensure that Canada has the most doses per capita of any country in the world. So what we're doing, Nav and I and the rest of our government, is to ensure that we're operating on multiple tracks at the same time. The $126 million investment in the Royal Mount facility for biomanufacturing that Nav referred to is one prong, but continuing to put in place complex contracts for vaccine procurement regardless is another. Thank you.
And if I may just add that not only do we have twice as much per capita of doses than any other country, the next country is Australia, it has half as many doses per capita as we have secured, but we also have, according to experts, one of the best portfolios of vaccines. And I think we're seeing this increasingly demonstrated by what is happening with the news from Pfizer, Moderna, and AstraZeneca.
Thank you. Minister Ryan, follow-up?
Yeah, I'm understanding what you're saying about the diversity and the size of our vaccine portfolio, but the Prime Minister was pretty clear today that despite that, we're going to get them after other countries. And so I'm wondering why there wasn't a bigger investment made in vaccine production here in Canada to address this problem, or is it just an issue where money wouldn't have solved this problem?
Well, thank you very much again for your question. And we need to recognize that building these complex biomanufacturing facilities takes time. And that is why we made the investment in the National Research Council Royal Mount facility, which will be able to produce 24 million doses a year. So we're confident that we are starting to build that capacity domestically, and we've made the investments. But as the Prime Minister alluded to, the vaccines that we may have access to that are effective and safe are international vaccines that we're going to have the logistical process in place that my colleague, Minister Anand, talked about. So we're confident, I think if you're a Canadian listening to us right now, to say is that not only do we have made in Canada solutions and capacity here in Canada, but more importantly, if a vaccine is made available, that we're going to do the due diligence with the approvals with Health Canada, as well as make sure we have the logistical framework in place to make sure Canadians have access to safe and secure vaccines. And that's been the objective. And so it's a combination of supporting made in Canada and domestic biomanufacturing capabilities, as well as partnering up with our international suppliers as well.
Merci, Monsieur le Ministre. Ceci met fin
And
à la
just to build on that,
Go ahead, Minister.
sorry, just to build on that excellent point that Nav made, I want to stress that we aren't sitting on our heels waiting for Health Canada approval. We are in constant touch with our vaccine suppliers to ensure that when Health Canada approval on that every day, and we will continue to update you as we can. Thank you.
Merci, Madame la Ministre. Ceci met fin.
Thank you, Minister. This brings today's press conference to an end.
Thank you. Merci.